Hello, Carol Johnson.
Well, good morning, Bob Ponce. How's it going?
Well, I hear sirens in the background as I have all morning, and that's probably the appropriate way to set this show off because we're talking about the second surge here in COVID-19. Oh yeah, it's it's going down.
Yeah.
Yeah.
Who just passed me about 2 minutes ago?
hmm So what we're dealing with is the same thing we've been talking about it since the end of the summer, that we have a second surge coming. Well, the second surge is not coming. The second surge is here and it's in full force. So we want to basically get people to really acknowledge, what situation we're in now. So we're going to grab a few slides from our governor, who makes the best PowerPoints, and since we don't have an intern and our tax dollars paid for it, let's take a look at what's actually going on in the state. So here's a graph of the COVID rates from August to November 29th. So August, we were sitting at 0.78%. By October 29th, it had almost doubled to 1.44. But between October and November 29th, it is more than doubled to 3.55. And as you can see, it's still rising. And what does this translate into? It translates into rising hospitalization rates, which had bottomed out in August to 429 people, and that had more than doubled by the time October had rolled around to 1,085. And, by November 29th, this is up to 3,500. And obviously, with the Thanksgiving holiday, everyone is expecting these numbers to continue to rise at maybe an even faster rate. So that's what we're dealing with right now. Those are some pretty serious conditions that we're looking at.
What's going on is just total recklessness. People just refusing to adhere to basic principles to keep us safe and to keep us alive. Still, you're talking about your rights, and yet you're taking away the rights of other people to live. People have to work, they have to shop, they have to go out, they have to do things. But we are back to the same stage we were back in, I believe it was in June, July, when they were asking us to kind of shelter in place. They put out a special order to the seniors and people with immunosuppressed systems to start staying home, to not leave the home. I understand. We understand this is a tradition to get together with family. But a lot of you are going to be very, very surprised come the end of this month. When these things start, these numbers start to possibly double. And then with the same negligence is going to take place. And I don't know what it takes to get through to people.
And then what we have to contend with right now is that in many ways the situation is worse this time around. And one of the reasons why is that last time around the COVID rates were primarily New York City rates. Now, as we can see in these charts, all of New York State is this. We've got the same thing going on, and so what that means is that there are no resources from other places that can be redeployed here. Every part of the state is dealing with this, and literally every part of the country is dealing with it really even worse. So last time around, when we had a deluge of hospitalizations, we had a lot of doctors and nurses who came from all over the country to help us. No one's coming. There's no cavalry at this time because everyone in other parts of the country are dealing with the same issues. Yeah, it is unbelievable that we're hearing in El Paso, Texas, of bodies in refrigerated trucks, which is the same thing that we dealt with 6 months ago, 7 months ago. And by the way, we still have some of those bodies. Where are they? They're offshore or something like that.
Brooklyn, 650 unclaimed bodies in
Mm-hmm.
makeshift morgues and freezer trucks off the Brooklyn waterfront.
Mm-hmm. Mm-hmm. So we still haven't buried the bodies from last spring, and it is very likely that we're going to have another surge of hospitalizations, and some of those hospitalizations are going to result in deaths as a result of um, breakdowns all over the place. And so we start with ourselves. We all let our guard down, and now it's time to get the guard back up. Um, the other thing that we're dealing with is, and we've talked about this a lot, is that there's been a huge testing gap that's underscored by our city's failure to provide adequate testing in our hardest hit areas. And we continue to see this, which is that one of the things that we talked about is the lack of testing facilities in our area, the lack of information when these testing facilities are available, so-called mobile testing. And the other thing is that we were told that we were going to have free testing for all. And free testing for all is not actually free testing for all, because so many of these testing locations are urgent care centers who actually charge for the test. And when you go into our areas and you see this, uh, so many of these places are charging, and that right now in the middle of a pandemic, we should have all hands on deck. We should have as much testing as available. We're supposed to have the test and tracing core, and where are they? I haven't seen them.
I have absolutely no idea where they are.
Mm-hmm.
Uh, they're looking to hire more people.
Mm-hmm.
And the ones that have worked said they're not adequately trained. They really don't know what they're doing. Although the city is saying it's working, but the actual tracers and testers are saying is not. So
Mm-hmm.
who are we to believe? You
Okay, and now let's take a look at some of the city's actual information about testing locations, because here we're looking on their site. Okay, so here on the city's page about getting tested, here it says mobile test sites. So Bronx, Brooklyn, Manhattan. Let's look at Manhattan and see what mobile test sites we can find. Okay, so we have one test site at 34 Spring Street. And we have another test site that's at the Penn Station Arrival Hall on 31st Street and 8th Avenue. Now, none of these sites are anywhere near where where it's most needed. What we've been told, from the city's maps, is that we have areas in Harlem and the Bronx that are in so-called yellow zones, which they now have these designations of yellow, orange, and red. And obviously it starts at yellow, and in an area where you see the numbers increasing, it's likely that those numbers are going to inch up into orange and red. So let's take a look at the map. Let's take a look at that map and see um, what we're looking at in terms of where. So here, okay, so here's Harlem, and we have a big stretch of Harlem and Washington Heights. That's a big yellow area. We can also see yellow areas in the Bronx. And so these are the areas that are right now, according to the city's maps, most affected. And as we back the map up, we can see that there are also yellow areas in Brooklyn and Queens, and Staten Island is really hot. They've got yellow and red areas. So you would think that these are the areas where we see additional testing resources, but we're not seeing these resources. As you saw from the mobile testing site, there's no mobile testing sites in these areas. They're down on Spring Street and on 31st Street and 8th Avenue. So this is something that I think everyone needs to be outraged. And so we're looking at everyone. We're looking at our elected officials in Harlem to make their voices heard. We're looking at the mayor and the governor to start working more in concert, because in addition to these things, we have questions about all the information we're getting. You know, should we be looking at the state information, the city information? There's a lack of transparency and clarity about the numbers, and we all agree that they're going up, but we don't know how much they're going up, because if we don't have the testing properly in our areas, maybe we're not yellow, maybe we're already orange, or maybe we're already red. And the differences between where we are translate into hospitalizations and possibly deaths. So lives are at stake. We need better information. We need better resources for testing in the areas that have been from the beginning throughout this whole pandemic. We already know where the problem areas are. And from the beginning, there's been a lack of testing in our areas. As you all recall, back in the spring, they set up testing in the middle of Central Park. Now, Central Park is surrounded by the area that has been least hit by all the maps we've seen. The area around Central Park has been the least hit. They've been the most heavily tested. And why were resources deployed there instead of being deployed in the areas that were hardest hit then and continue to be the areas that are hardest hit?
And as you said, we may already be in orange zone, because we know the numbers are not in real time. So, we have to push everyone, not only the elected officials, the community workers, our city council people, our leaders, the community leaders, who know where the people are, the most vulnerable people are. We all need to get together, and we need to express outrage. It's gotten to the point where we're talking about outrage, because not only are the hospitals, as Bob said, you cannot count on anyone coming to save us. The cavalry is not coming. Our medical resources are stretched to the max. The hospitalizations, the ICUs are coming close to the max. And we are not in a good place at all. The nurses are seeing, one nurse is seeing double the amount of patients that they would normally see, which is unsafe. Not only for them, but for the nurses. And while everybody's running around partying and thinking it's okay, it didn't hit me. I heard a term called yet. You're eligible too. It can hit you at any time. And the saddest part about it is these people are working so hard to keep people safe, to keep people alive. They are crying out, we can't do it anymore. We've got nurses in New York State that are picketing. And the hospital is saying, it's always the big corporations that's always trying to put it on the backs of the workers. But they're saying, you're putting patients in jeopardy. The nurses are saying, no, you're putting the patients in jeopardy. How are you doubling our workload in the midst of a pandemic? The doctors, they've got more than enough ventilators now, but they don't have the amount of pulmonary specialists who can operate them. So we are in actually worse shape. We don't have a full capacity of PPE for our workers. So there's so many things that are different here, which makes it so much more important to pay attention. You've got doctors that are still showing up, nurses who are still showing up. I just read the article where the nurse's mother died. 3 days later, the husband died. And all she could do was bathe the husband, did something to his hair, and she went right back to work to save somebody else's life. And it's just very selfish for us to just think because it's not me and you're jeopardizing other people because you don't want to socially distance or you want to argue with somebody when they say you're supposed to have a mask on in this store. And remembering again, we cannot forget there's a lot of you walking around that have this virus who've never been tested, that are asymptomatic. And you think because you feel fine, let's see how many people feel fine when the numbers start to roll in after Thanksgiving. Remembering Christmas is a month away. We may not even have the Thanksgiving numbers, all the Thanksgiving numbers in real time by the time Christmas gets here, with New Year's a week behind. Between now and 2021, we're going to see some disastrous numbers.
That's the truth. And, you know, the governor made it clear about his concern about the hospital system being overwhelmed. And as I said, it's worse than it was in the spring because it's the whole state. So they're even talking about having an emergency stop, which they're politely calling New York on pause, if the hospital system is overwhelmed. So what they're basically saying is that they're looking at scenarios where things are so bad that you think the shutdown before was shut down, there's another level of shutdown where everybody is going to be shut down and nothing's going to be moving because there's nothing, you know, everything is going to be overwhelmed. And these are the scenarios we're looking at. So, you know, we've been talking about this for months, and we still don't understand why we don't have more adequate preparation for this, knowing that this was coming, knowing that all the experts saying that we were going to see a second surge, and you know we're not ready. So it's time to get ready. This is the governor's personal opinion, was that the numbers are going to increase through mid-January. Hospital capacity is a major concern. Everybody's talking about the vaccine coming, but here it is in the governor's words: a vaccine doesn't hit critical mass until late spring, summer at best. So a vaccine is most likely not going to save you because number one, it's not here. We're already in the risk area. In other words, the highest risk since the spring is going to be over the next 2 to 3 weeks. Coming out of Thanksgiving, we know the numbers are increasing already. So there will be no vaccine to save you. And so we're getting back to what we were saying, what we've been saying since the beginning of this. We said it in late February, we said it in early March, we said it in April, and we've said it since then, that if your best bet in getting through this, you need to boost your immune system. This is information that for the life of me has not come from our Department of Health. I don't understand it. I kind of understand it in the spring, even though we were talking about it. And when we asked the Department of Health about, well, why aren't you telling people to use vitamin C and vitamin D and zinc to build up your immune system? They were like, well, we won't tell you not to do that, but they acted like we were talking about something wacky cure from that hadn't been vetted by science. Well, there have been numerous studies that have backed up everything we said. There Since we've said it, there have been even more. So anybody can Google it: vitamin D and COVID-19, vitamin C and COVID-19, zinc and COVID-19, and you will come up with many, many evidence-based studies that prove the correlation between having these vitamins in your system and better outcomes for COVID-19. So let's get back on it. We talked about the fact that you can get these supplements. They're over the counter. You don't need a prescription for them. But the other thing is that you can also get these nutrients in your body from food sources. So we'll tell you once more again, uh, many sources for vitamin D: butter, cod liver oil, eggs, fish, meat, milk, salmon, sardines. Vitamin C, many, many sources again: aloe vera, black currant, broccoli, Brussels sprouts, cabbage, capsicum, cauliflower, citrus fruits, collard greens. Many of the things that you have for Thanksgiving might help protect you, but you need to take more of these. Vitamin E, all these things help protect our bodies, help create antioxidant conditions that reduce the inflammation that is a key part of the problem when why people are dying from COVID-19. And there's one that has not been talked about that we're going to bring up today that we saw some recent information at, and that is melatonin. Melatonin for the melanated. So they had an analysis of patient data from Cleveland Clinic. For those who don't know, Cleveland Clinic is one of the most renowned medical facilities in the world. And so this is not quackery. This is evidence-based science. They examined their COVID-19 registry and patient data, and they showed that melatonin usage was associated with a nearly 30% reduced likelihood of testing positive for the SARS-CoV-2 virus, which is the virus that creates COVID-19. Now, but here's the kicker. For African Americans, this likelihood of reduced likelihood of testing positive increased from 30 to 52% when adjusted for the same variable. So what they're basically saying is for Black people, melatonin protection is even higher, 20 percentage points, 22 percentage points higher. And so melatonin is something that, again, it's something that you can find in your pharmacy over the counter. And there are also a number of different food sources for melatonin as well. Including eggs, including nuts, including a number of sources. You can Google that as well. So now is the time that you really protect yourself. And let us not forget, this is not neglecting the most basic and fundamental tools that we need to use, which is wearing a mask at all times when you're outside, social distancing, especially if you're indoors with other people besides your family members, and you shouldn't be indoors with more than 10 people, and especially during the holidays, if you're in an enclosed small apartment, reduce that number. You don't need 10 people in a small apartment. 10 people, you spread it out in a house, you might have a better opportunities, but make your adjustments accordingly. Protect yourself. We know that you want to get meet with your family, but how many times have we heard these stories from other people? They had weddings, and then 3 weeks after the wedding, half of the people who were at the wedding come down with COVID. And so this disease spreads based on people's reckless and ignorant behavior. That's the number one cause of the death rate right now. So your best way to stay alive is don't be ignorant and protect yourself.
Most certainly. Even now, I suggest that people even quarantine within their homes.
Mm-hmm.
People who are around a lot of people, in particular, if you traveled out of state
Mm-hmm.
for the Thanksgiving holidays, you probably should look at doing that quarantine. But the people in your household, your immediate household, need to
Mm-hmm.
socially distance and continue to wear masks.
Mm-hmm.
But if anyone has symptoms, you know, you need to go check that out. It's not like it was before
Mm-hmm.
where people were getting symptoms 3 and 4 times and they were being told to stay home. And
Mm-hmm.
that's why the numbers were rising so much and so quickly
Mm-hmm.
because people in black and brown areas that was being told to stay home. But there's a reason why, in other areas like where these mobile sites are, those were the lightest hit areas. And
Mm-hmm.
it makes sense because they've always had a whole lot of testing sites.
Mm-hmm.
Those people down there have insurance. They can run into any urgent care center and get tested and not be concerned with what we found out could be from $300 to $1,000 bill. I
Mm-hmm.
remember watching the mayor talk about this as if it were the first time he ever heard it. This was last week, as if it was the
Mm-hmm.
first time he heard it. And he said, well, it's not, it's supposed to be free, but good answer, Mayor. Good answer. You know, I mean, come on. What's going on? So the thing is, yeah, we got to go back to where we were before. Anybody exhibiting symptoms, and whether you're exhibiting symptoms or not, if you went out of state, if you were around a group of people, there's absolutely no way that whether somebody in that group was infected. And if you had somebody at the door with
Mm-hmm.
the thermometer, again, that does not mean that you did not have people in there that were infected. And so at
Mm-hmm.
your home with your initial family, you need to still practice socially distancing in your home. You need to wear
Mm-hmm.
a mask and you need to live as if you're in quarantine and continue to sanitize the highly or frequently touched areas, in particular your bathrooms, your knobs, your toilets, your sink, your the nozzles for the sink in the kitchen
Mm-hmm.
and the bathroom. The refrigerator handles, things that people are constantly touching. 1 part bleach, 9 parts water. Put it in a spray bottle. You don't have a spray bottle, put it in any bottle. Shake it up, get a rag, wipe those areas off. And it's better to have a spray bottle because you just need to spray those surfaces and go from place to place. Let the bleach settle to neutralize the germs and then come back and wipe them down. But this is a practice that you need to do now. Husbands, wives, they said you need to sleep foot to head, but you need to still practice distancing in your own home. And please do not, if you went out and did that for Thanksgiving, please don't repeat it at Christmas. I mean, we're literally begging you. All of our lives depend on the actions of others.
COVID is the gift that keeps on giving, and not in a good way. And we've talked a little bit about this over time. Is that we're still learning the long term effects of it. So when it comes to COVID and your children, you need to protect them and don't assume that they can't get it. Or there was that erroneous thinking early on that kids can't get it. Well, kids can get it, and whether they even if they are not put in a life-threatening situation, it may still be a life-altering, because we're just now starting to see the long-term effects in so many different medical categories. We just saw a story, and this is also, we already know that people who have comorbidities, pre-existing conditions have an even lower tolerance for COVID-19. Now we're seeing a story that that they're showing somebody who was a cancer patient who 2 months later from having COVID is still shedding the COVID virus. And so, this is, again, we get more information that this disease can linger on a lot longer, and they don't always know why. But if this cancer patient 61 days later is still shedding this virus out, these are things that we have to be concerned with, is that this thing lingers. It didn't leave New York. It just waited around. Okay. Take the summer off, and it came back from summer vacation with a vengeance. And we have to be just as vigilant as this virus, because this virus is not taking prisoners.
And when you question why it came back with a vengeance after the summer, it's because the reckless behavior, the big barbecues, the big cookouts, all the people, again, the asymptomatic people. One person. They said the reason for most of the clusters, most of the major rising of this virus comes from family gatherings. And that's been said a long time ago. It's family gatherings, because all of those people, with the exception of the host, are going all over to different places. Can't say it enough. Again, asymptomatic people. That's what took it back up. And the reason they knew the wave, there was another wave coming, was because during the summer, people all of a sudden went into oblivion, like, okay, summer came, it's gone. People were saying, well, the heat kills it. No, it does not. That was established a long time ago. And now we've been blessed to still have some nice days. But these days are going to get colder and colder. You're going to have less and less places to go. And so if you have not been doing it, it is time to get busy. This is, I don't know about anybody else, I'm like, usually just cool. I go, I do what I got to do. I go, I come back, and my fee is not even for myself. It's for you. For you, those of you that are playing Russian roulette with your lives and the lives of your family members and your close friends, children. They say usually when you have an environment with a lot of people, it's been proven oftentimes that virus is coming from that child. And as they call the poor little children, super breeders. So they may not have symptoms. They may be fine. But we are not paying attention. You can't tell me you love me and pack into a small apartment to eat some turkey. You can't tell me that you love your family member when you got Aunt Sarah, 85 years old, because she makes the best potato salad in the family. That's where Zoom and what we're using, StreamYard, and all these different social medias come into place. We're telling you emphatically, the numbers are going to increase very soon. Please pay attention. Don't sit back waiting for a vaccine, because it's going to be a long time before people like you and me, if we're not frontline workers, are going to get that vaccine. And then you got to think about it. Are you doing any research on them now? What are they going to be giving you? Even the doctors are saying, yeah, they come with some side effects. It's not one shot, it's 2 shots. And the doctors are fearful that people will come, take a shot, have these symptoms. But the good thing is they say the symptoms don't last a long time, not as long as COVID symptoms. But the symptoms are pretty miserable. And you'd have to go back and get another one. So what is the wait time? I mean, do your homework. That's what Google, I live on Google. That's what Google is. pull up these different companies, know what those side effects are, talk to your doctor now. If you don't have a doctor, you can call, you can Google telehealth services, ask questions,
Yeah,
ask questions.
find out. Because as you know, they say the early bird gets the worm, but they also say the second mouse gets the cheese.
Okay.
So, you know, when it comes to these vaccines, let's understand the conditions that these vaccines are being marketed to us. Now, why do I use the word marketed? I use the word marketed because the vaccines have not even been approved yet. But I got an email from Rite Aid telling me that they would have vaccines available, which
Okay.
I find interesting. Now, we know a couple of things about the vaccine. So we've got Pfizer, AstraZeneca, and Moderna now applying. We know that a couple of these solutions require extreme cold, like 70 degrees below zero. It has to be kept. So there's a lot of infrastructure that has to be put in place just for these vaccines to be available. You know, so it's not like just shipping, bottles of aspirin. There's a lot that needs to be done, and we need to know more about the side effects. We need to know more about the testing process that went on. Um, we also need to acknowledge that there's been a breach of trust from our governmental agencies that look out over this thing. Now, this vaccine gets shepherded through the FDA, and we've had a politicized government that seems to cater to the whims of these pharmaceutical corporations, who we know that the vaccine is a big profit event for them. So I'm not suggesting that the vaccines may or may not work. I don't have enough information, but I do know that we need to be prudent and really understand the dynamics, because we've seen, hand in hand, our FDA take a blind eye to pharmaceuticals. We just had this company, Purdue Pharmaceutical, who has. Oh, by the way, let's back up a second. Before the pandemic crisis, the number one health problem in America was the opioid crisis. And the opioid crisis was a crisis that literally was created by the pharmaceutical companies of America overselling basically drugs that had no business being on the street. These were drugs that were initially approved only for use in cancer patients who were at in dire need and in tremendous pain, and instead they were able to flout the laws with off label marketing and flood the whole country with these drugs, and we were losing 70,000 people a year to overdoses from opioids. So over the course of the last 4 years, we probably lost as many people to opioids as we have so far to COVID-19, although COVID has come and done it in less than a year. So, and all this happened with the same FDA that is now in charge of approving this vaccine process. And we know that we're coming out of an administration that basically first denied it and then all of a sudden rushed to get a solution in place, and they tried to have it in place before the election. So I think it begs the question: do we have enough information about the vaccines that are being presented to us? We know that they're supposedly gearing up to have 600 million doses, so that 2 doses for every American, and a chicken every pot and a car in every garage. That's great, but let's understand that there are no one size fits all health solutions, that there have to be situations where some people may or may not be right for the vaccine, and let's evaluate it like we do anything. And as we already told you, we're not likely to have the vaccine in place in time to deal with the second wave surge that we're talking about now. So while we're preparing ourselves with the means that we have, let's get more information about what's going on with these vaccines before we just say, oh, the vaccine is going to save me. And remember, the vaccine is a preventive measure. It's not going to be in place in time for this surge. So you need to take other preventive measures. You need to wash your hands. You need to social distance. You need to wear a mask, and you need to boost your immune system. It's that simple.
I'm sorry, I have to keep muting myself. These guys are still on
That's
my
okay.
roof. Yeah, it really is. It really is a simple process, and it becomes second nature. You know, if you look at it as a major thing, it's like wash my hands and wear a mask, socially distance, live.
Mm-hmm.
Or wash my hands, socially distance, wear a mask, become chronically ill where you wish you were dead.
Mm-hmm.
So I don't know about this administration who's running around talking about, I thank God. First time I ever heard God come out of his mouth. I thank God for getting COVID. But that was, that was just a ploy to get votes.
Mm-hmm.
But I dare you to ask somebody who had it and see if they tell you the same thing. They thank God. There are people who have this who are literally living like hermits and will not leave their home. Fear of getting it. I know people who got it will not let their children in their homes. The children do all the shopping. They have not been out in months. And they refuse to leave the home. And those bags must be left outside the door. When they leave, they open the door and snatch the bag in. That's no way to live. But that is just how dreadful, how painful, this thing is from head to toe, with the body aching, your head feel like it's about to explode, difficulty breathing, stomach, bowel problems. Who wants that? Who even wants to take a chance on getting something like that? And anybody who's had chronic illnesses, you know, I know, like myself, I know what that feels like. I'm certainly not going to recklessly invite a visitor like COVID that will come and may never leave. I can't even make sense out of the judgment um, of those who are still not wearing the mask properly. Let's address that again. Nose and mouth. And the interesting thing is that people will have them over their mouths, not recognizing that most people breathe through their nose. And you're really spewing more emissions through your nose than your mouth. And people are walking around with it under the chin, on top of their head, on their wrist. That's not going to work. It's got to be over your nose and your mouth. And you know what? If you don't want to wear it like that, look at the street. Look how many people is on the sidewalk. If this side has a lot of people, go to the other side. Pull it down for a little while when there's nobody around. Pull it down, and then put it back up. But we got to remember, too, that it is airborne. So just because nobody's there now doesn't mean that the droplets are not still in the air. The aerosols are not in the air. That's the same thing. The aerosols are so small, they spew beyond 6 feet. I believe they said they can go actually maybe about 30 feet. And they stay in the air for hours. So there's a lot to contend with, but not if you just make up your mind, listen, I want to stay safe. Most importantly, I want to live. I know we all got to die. We don't have to go that way. But I want to stay as safe as I can. And these simple practices, if I can do that and keep my family safe, because if you're not practicing it and you live with somebody else, every time you go out and you come back, you stand a chance of giving it to them. So yeah, it's not how they say the me, it's the we.
Hmm.
The we got to do this together. What we can't do alone, we got to do this together. Fight it
Mhm.
together. Us, we
Mhm.
don't stand a chance.
So, before we close off, I want to acknowledge all of the healthcare workers who have, from the spring through now, have gone above and beyond to help us address this crisis. They've saved many, many lives. They put themselves on the line, and many of them gave their lives to this. So we need to acknowledge that. I was listening to over the weekend. WHCR, they do a health in Harlem show with some of the doctors from Harlem Hospital, and I was listening to two doctors talking about what they're thankful for. And they were just talking about how during this crisis they had to be away from their homes, from their family, with staying in an Airbnb so that they would not bring the virus back to their own family. And these are the kinds of sacrifices that our doctors and nurses and other healthcare workers, ambulance drivers, so many people have gone above and beyond to just keep us safe, and we acknowledge them, but I don't think we acknowledge them enough. So I wanted to bring that up. Also, so many of the community activists who have, during this whole pandemic, have been out there. Number one, there's been so much activity around food programs, because while we're dealing with the pandemic, we're also dealing with the economic pandemic and hunger issues, food insecurity, whatever you want to call it. People not having enough to eat, quite simply, and community resources is what's kept us together. Community resources what got PPE out to people early on, way before the governmental agencies. We've been doing it for ourselves. I acknowledge you, Carol, for all the work that you've done in terms of getting PPE in East Harlem, in Central Harlem, in the Bronx, throughout this. And we still, community activists are still working so hard to make sure that we're safe during this. And this is why we implore people to get actively involved in your own health and safety and well-being. We cannot do this. We have to get through this together. That's the only way that we can get through this process. And so please listen to this information we're sharing with you. We're not trying to scare you, we're trying to prepare you. It's as simple as that.
I appreciate that, Bob. We, our teams, both Harlem Emergency Network and the East Harlem Co-ed, we work. We studied for times like this. We were prepared for pandemics and getting information out. That's what we do. Getting information out. We're responsible for the effort, not the outcome. You know, being response teams, mitigation teams. So I don't take credit for that. I appreciate the ability that God gives me to do what I do, you know. But again, you know, the more people I keep safe, the safer I can be, you know.
Right.
And there's a lot of people that are extremely vulnerable. When I go through the streets, I carry a bag with a couple of things of sanitizer, that if somebody has a bottle, I'll fill up their sanitizer bottle. They don't have masks, I'll give them masks. We're so underserved.
Mm-hmm.
So underserved. You see people walking around with masks that are three different colors. They've washed them so much. So as I'm usually always out, in the street, and I'm
Mm-hmm.
handing out masks to people. And the gratitude that people have when they say, I've been looking and asking people, where can I get some masks? And
Mm-hmm.
they're not to be found. You know, I mean, all of us can participate in this.
Mm-hmm.
Go to your community leaders, ask them, where can we get some PPE? You got a table in your house, a little fold-up table. Most all people my color got a little card table. I know how folk like to sit back and play whist and bid whist. Spades. Get a little card table. Take it outside. Give out masks. It's a very simple process. You can even get, from most of them, you can get sanitizer. We can all participate in helping our community. There's no pats on the back with this. This is what we should be doing. Helping someone who can't help themselves. Giving information to people who may get the information but haven't gotten it. Listening is an art. Just because you heard it doesn't mean, just because you heard it doesn't mean you were really listening. So we have to keep doing this over and over and over and over again. Like I'm saying to Bob, this is like a 12-step program. How do people stop drinking? How do people stop overeating? How do people stop smoking and gambling? Because they get the same 12 steps, the same thing over and over and over again until it finally sticks. And if you just get it started, just at least wear a mask. And we shouldn't have to be pleading with you to save your life and your family lives, but we are. This is getting serious. We haven't seen it yet. They said come the beginning of January. And again, you got to look back. There they go again. You got to look back at the lack of medical staff. You just don't have the people that's even going to be people, treating people.
Yeah.
So.
And the other thing I want to say is I want to acknowledge, we've been critical of, some of the response or deployment of resources from some of the city and state agencies. It's not to dismiss the fact that we know people in these various departments and agencies who've been working long and hard. And so our criticism is not to say that we're not appreciative of the efforts. But the simple fact is that we need more than the effort. We need our best results. We don't have the luxury of saying, oh, well, shrugging our shoulders because lives are in the balance. And so when we see from our vantage point, because we're on this, we're in the streets, we're in the communities, we see what's going on, we see the lack of resources, and so we're not talking about it just to, we're not whiners and complainers. We're pointing legitimate problems in the delivery of services during this pandemic. And it is not an aspersion on people's character or intent, but we need more than character and intent. We need results because we have unique problems and we have a diverse population. And in order for us all to get through this in New York, we need the best of all of us. And so we keep ourselves accountable. We started this by talking about everyone is to blame for the situation that we're in, but everyone can be part of the solution, not part of the problem. So we're encouraging you to be part of the solution, and you can start today by taking care of yourself. Because as we say, yo, you're on your own. More than ever, we can look and see that in this particular second wave surge, resources are going to be stretched to the limit. And so do not assume that things are going to be there for you if you haven't taken care of the basics for yourself.
Right. What's that they're saying about everybody? One can do something. Everyone's waiting for someone else to do something when you can do it yourself. And it was very painful sitting back and watching people. I got to give a shout out to our East Harlem City Council Person District 8, Diana Ayala. Diana Ayala was so on her game. And this is why we need to speak up to help those people like her who's out there every single day.
Mm-hmm.
Every day. I mean, I've done so many events with Diane. I'm not talking about one. I'm talking about she's like 5, 6, 7 different places. And she had to quarantine. Her entire family had COVID. And she
Mm-hmm.
was still working on the phone, getting us PPE. So when you see people like that who have experienced it and they are out there, boots on the ground every day, still pushing. Yesterday, she was in the senior buildings going from door to door with packages of PPE. When you see people working like that and you watch them and they are so angry, they're reduced to tears because they're fighting with the higher ups to get stuff for their own community. She needs people. Your community leaders need your support.
Mm-hmm.
They may be in that position. You may have voted them in, but they need your voice to push it. Jumani Williams, our public advocate, all over the city. He and Philip Ellison, the Manhattan advocate, all over the city getting us PPE. What you need, Carol? I need 10,000. I'll meet you. How much sanitizer you need? Give me about 5 gallons. They still have stuff waiting for us. I have to reach out to NYS. They got us so many supplies. They have the power. They've got the money to be able to do it. They've got a little more pull than the smaller agencies like us.
Mm-hmm.
But we were already stockpiling. We have stockpiles now in East Harlem and Central Harlem. We're going to be doing pop-ups around the place. We got probably more stockpile than the city to give to their frontline workers. So when they told us there was a second wave coming, we started piling up. Thank God we finally got storage space. We started piling up. Not for us, for you. And then when we out there in the street, vulnerable health situations, personal health situations that many of us have. And you look at us and curse us out when we try to give you a mask to save your life and the next person near you. Come on now, we got to get serious about this. We can't keep talking about say it loud, I'm black and I'm proud. And we're putting each other at risk. We can't keep talking about how other people treat us when we looking at how we treat ourselves. And I got to make it personal, how we treat ourselves. We can't worry about downtown. I'm not downtown. I'm watching too many people sit here and wave, oh man, I don't need that mess. I literally got cursed out when I tried to offer people free masks. Come on, we got to stop this madness. We got to stop it. If we still talking about how other people treat us, how other people have treated us, we talking about slavery and everything else. Let's look at how we treating each other right now in a life and death situation. We got to get this thing serious and stop playing. Stop shucking, stop jiving, stop dropping it like it's hot. Let's get on the ball because I want to see 2021 and I hope you want to see it too. I want to take my friends and my family members with me. And that depends on each one has to do something. Even if you just go into your local public official's office and say, listen, you need some help. Maybe they may not even have any help for you to do. You need me to hand out some flyers? I'm going to the supermarket. I got to walk 4 blocks. I'll hand out some flyers while I'm on my way. This is where PPE is being distributed. Everybody's on social media. You get a flyer, take a picture of it. Put it on your Facebook, your Instagram page, whatever social media you're on. Take a picture of that flyer. Pass it on to the community. This is how a community works together. And also food places. There's places you get a flyer where there's pantry and food, available. Bob be bringing me some slamming food from Salem, because it's on the Upper West Side. I mean, some slamming meals. People need food. A pantry, you get a flyer, stop throwing them away. Take a picture, put it on your social media page. It's just that simple. We can all lend a hand to help us stay healthy and safe.
Mm-hmm. So we're gonna wrap up from here. We're gonna say the same thing we do every time. Stay safe. Don't be scared. Be prepared.
Absolutely. Well, again, happy holidays to everyone. Happy safe holidays to everyone. Stay safe.
See you next week.